Suppose mammography had never been developed, just how much would we understand today about breast cancer? Without it, the number of more women might have passed away from breast cancer. Unlike mammography, no routine test, such as a pap smear, can yet detect ovarian cancer. Each year, around 22,000 females in the United States are identified with ovarian cancer and 14,000 die from the disease. Most of the patients have advanced cancer, and 80% to 85% have a recurrence within 2 years. Ovarian cancer is the most fatal gynecologic cancer, with roughly 45% of clients surviving only 5 years. The death rate from ovarian cancer has actually changed very little in the past 40 years. By the time ovarian cancer is identified, it is already in stage 3 in almost 51% of patients, meaning it has spread out throughout the stomach cavity. If cancer is found earlier, a survivor has a greater 5-year survival rate. Who is at threat? Numerous factors can increase the risk for this illness, and approximately 1 in 75 ladies get this cancer. Age. Ovarian cancer can occur in any age, including girls and ladies, however it is most common in women aged 50 to 60. Genetics. About 15% of ovarian cancers are triggered by an acquired anomaly, alteration, in the BRCA1 or BRCA2 gene. For that reason, women with this family history of BRCA, and some with no history, are now being checked for this genetic change. These genes can also increase a female's risk for breast cancer. If you have a genetic danger, you may require to have routine pelvic imaging and blood tests to look for this cancer. Genetic anomalies that trigger Lynch syndrome, which associates with colon cancer, also increase the risk for ovarian cancer. Other risks consist of long-lasting use of estrogen replacement therapy, early start, before age 12, or late ending, after age 52, of menstruation, never being pregnant, cigarette smoking, and polycystic ovary syndrome. Signs. The symptoms of ovarian cancer are vague and are not specific to cancer, so they are hard to link to cancer. They consist of stomach or pelvic discomfort, feeling full quickly while eating, bloating, urinary urgency, bleeding abnormally. In addition, some patients might experience discomfort throughout sexual intercourse, extreme fatigue, indigestion, irregularity, neck and back pain, and changes in their menstruation. If these signs take place almost every day for 2 to 3 weeks, see your medical professional. Diagnosis. The first step in diagnosis includes a blood test called a CA-125, cancer antigen 125, which determines the amount of the CA-125 protein in your blood. However, some ovarian cancer cells don't express this protein, so developed illness can be identified with low levels of CA-125. The second action is a pelvic test and a transvaginal ultrasound, which may or may not definitively identify ovarian cancer. If the ultrasound is suspicious, a CT scan will frequently be purchased to confirm the medical diagnosis. Nevertheless, a conclusive medical diagnosis can just be made with surgery, which shows the level or the stage of the cancer. If ovarian cancer is diagnosed, the decision should be made, based upon the test results and the woman's total health status, whether to have immediate surgical treatment or to begin chemotherapy first, followed by surgical treatment after the tumor size is reduced. Phases of ovarian cancer. The stage of the illness shows how far the cancer has actually spread, which determines the course of treatment. Other elements that affect the grade of the tumor are categorized as A, the least aggressive, B, less aggressive, and C, more aggressive. The 4 stages of ovarian cancer are: Phase I. The tumor is confined to one or both ovaries and has not spread out outside the peritoneal cavity. No ascites, excessive fluid triggering bloating, is present, and the tumor has not burst. The 5-year survival rate is about 92%. Phase II. The tumor extends beyond the ovaries and has actually spread to other organs in the hips, such as the uterus or the fallopian tubes. In this stage, the 5-year survival rate has to do with 73%. Phase III. The tumor has spread out beyond the pelvis into other areas around the abdomen. The chance for 5-year survival drops to about 28%. Phase IV. The growth has actually spread to the liver, lungs, or other organs. The possibility for 5-year survival drops to about 22%. In addition, ovarian cancer includes a number of types. Epithelial tumors, particularly serous, are the most common type. They emerge from epithelial tissue and typically take place in postmenopausal females. The other ovarian tumor types affect fewer women. Treatment. After surgery, all those with stage 3 or 4 disease are offered 6 rounds of platinum-based chemotherapy, typically with among these drug combinations: platinol, cisplatin, paraplatin, carboplatin, plus Taxol, paclitaxel, Taxotere, docetaxel, plus carboplatin. In addition, patients are likewise given drugs to prevent nausea that are connected with chemotherapy. If cancer returns in less than 6 months after beginning a platinum-based therapy, this recommends that the cancer is platinum-resistant, suggesting that another drug needs to be utilized, such as Abraxane, nab-paclitaxel, Alimta, pemetrexed, Camtasar, irinotecan, Gemzar, gemcitabine, and a few others. Your physician will determine which is the best treatment alternative based upon your individual condition. Since early diagnosis is so crucial to the survival of a patient with ovarian cancer, women should listen to their bodies and seek medical suggestions if symptoms take place.